Hello. This is the fourth installment in our video series on the Medicare for All bill that's been introduced in the House of Representatives. In this short video, we're going to discuss what impact this bill would have on providers, physicians, and hospitals. So let's start out with some simple pros and cons. On the pro side, this would be much simpler for doctors and hospitals. There would be much lower administration cost. All of those people that are doing pre-certifications, referrals, etc. would go away under this plan. That's a good thing. There would also be no patient collections. Remember, this plan has no copays, no deductibles, no coinsurance, so there wouldn't be that whole process of billing patients for the part they owe. That goes away. Another reduction in cost, and that's a good thing. It would also be one standard of care. Everybody gets the same thing. Doctors wouldn't have to worry about whether or not a drug was covered for this patient and not that patient, because there would be one standard of care. This simplification would reduce a lot of the administrative expense in doctors' offices and would be welcome to them. Now, let's look at the cons. One of the big cons is reimbursement. The bill doesn't discuss how physicians or hospitals are going to get paid in any great detail, and more importantly, how much they're going to get paid. So that's a huge question mark in this bill. There's some discussion about global budgets for hospitals, but no real discussion on how those budgets would be set and how they would work. So there's a big concern in the bill about how does reimbursement happen. So let's take a look at how the current system pays. Roughly, commercial insurance on the hospital side pays hospitals an average of 89% more than what Medicare would pay them for the same service. That's cost shifting. On the physician side, the average commercial payment to a physician is 30% more than what Medicare would pay for that exact same service. So let's take a look at a scenario where under this bill, they decide to pay everybody at Medicare rates. I mean, it's Medicare for all, an easy thing to do, and we know legislators like easy, would just be to say that everybody's going to get paid at Medicare rates. In that scenario, hospitals and physicians would take massive cuts in revenue. Now, let's think about this for a second on the physician side. There are 1.1 million practicing physicians in this country. Under this bill, remember, they would not be allowed legally to provide care any other way than through this Medicare for All program. They can't create concierge medicine. They can't charge fee-for-service for a higher standard of care. That's illegal. So this bill in one fell swoop would take 1.1 million people and tell them, look, in order for you to practice your profession, to ply your trade, if you will, you have to do it the way we want you to do it and under the reimbursement that we dictate. And by the way, that's going to be a huge income hit for you. Now, I know a lot of people say, well, doctors get paid too much anyway, and it's okay if they take an income hit. They're rich. Well, yes and no. One of the things you need to consider when you think about physician incomes is this. Economically speaking, it's not a real smart thing to do to become a doctor on average. The problem is it takes you a lot longer in your training. So your earning period or your earning lifespan is much shorter. I started my career at 21. Most doctors, after they get through all their specialty training, don't start their career until they're 30-something. Okay, so I've been earning money for close to 10 years longer than any of my physician colleagues who are my age. Okay? Another thing you need to understand is physicians come out of school with massive amounts of debt. So they already start out behind the game. So while they may be earning more while they're earning, over the lifespan, it really isn't a wonderful thing to do. If you cut their reimbursement or cut their income significantly, it starts to beg the question, are our best and brightest still going to go into medical school when it's not a very good financial decision? And maybe they won't. So let's examine what happens if this bill passes and they decide to pay everything at Medicare rates. Well, hospitals will fail. Many of them will. They just can't handle an 89% reduction in revenue on a huge chunk of their business. Many doctors will fail, or more likely, many doctors will retire. Right now, over 40% of all the practicing physicians in this country are over the age of 55. So let's say this bill gets passed and has a 2-year lead time or a 2-year transition time. That means those physicians are going to be over the age of 57. Many of them are going to be in retirement distance, and many of them will retire. Again, hospitals will fail and doctors will fail. At the same time that those things are happening, we would see an incredible increase in the demand for services and care. Think about this for a second. Close to 20 million people would have an insurance card for the first time in their lives. And not just an insurance card, a free credit card insurance card. Remember, they don't have any cost, no copays, no co-insurance and deductible, nothing financially stopping them from utilizing services. The people who are underinsured are suddenly going to be overinsured. They're going to see a huge jump in utilization. And the people with good insurance suddenly don't have to pay anything for it. What kind of extra demand is that going to place on the system? So, at the very time that we could be losing hospitals and physicians and have supply drop, demand would increase incredibly. That could break the system. We could see significant wait times, barriers to accessing care, the kinds to which we haven't seen in this country ever. So, the question of what this does to providers, well, there's some really good things it would do, simplifying their business offices and their administrative expenses. But there's also some really bad things that could happen depending on how they get paid and specifically how much they get paid. And if those things are too low, it could break the system and we could find ourselves walking around with a free insurance card, but nobody willing to take it. Thank you.